My name is Faisal Ahmad and I am currently studying Doctor of Veterinary Medicine in the University of Veterinary and Animal Sciences, Lahore. Today my topic of presentation is a case study about successful management of macerated fetus in a Jafarabadi buffalo. To know that what is fetal maceration. Fetal maceration is the process in which a fetus dies after ossification within the uterus, and the fetus undergoes microbial digestion or putrefaction in the fluid of uterus till only the mass of bones remains. This is known as fetal maceration. Now let's move to introduction. Fetal maceration is a common sequelae of mummification and generally occurs in the event of death of fetus after formation of fetal bones, regression of corpus luteum, and failure of abortion, particularly after the third month of gestation. It has been reported in cattle, sheep, and mares, but is most commonly occur in cattle and buffaloes. Incomplete abortion after the third month of gestation is the main reason for a retained fetal bony mass in the uterus of cows and buffaloes. Now discussing signalement and history. A 7-year-old Jafarabadi buffalo naturally served completed gestation period of 340 days with no any signs of parturition, absence of relaxation of sarcosciatic ligament, failure of mammary gland development, foul smell discharge from the vagina, decreased appetite, treated for inducing parturition by the local veterinarian without any result, was presented at the veterinary clinical complex of Veterinary College, Junagadh, Gujarat. Now talk about pathogenesis. Following fetal death, bacteria enter the uterus through dilated cervix, leading to putrefaction and autolysis. The soft tissues are digested, leaving a retained mass of fetal bony matter in the uterus. The maternal uterus develops a severe endometritis, and metritis pus accumulates because the cervix is closed. The uterus remains distended, discharge is absent or minimal. The uterus becomes atonic, delaying clearance. Now discussing clinical findings. On the basis of clinical examination, the animal was active, alert, and the clinical parameters like rectal temperature is 102.2 degree Fahrenheit, pulse rate is 58 per minute, respiration rate is 29 per minute, were recorded at the time of examination. Rectal examination revealed contracted uterus lying on the pelvic brim, a thickened uterine wall, and the presence of bony prominence on the hard fetal mass was felt. The placentum were not palpable and phragmitis was absent. Vaginal examination revealed a hard and one finger dilated external os of cervix. Based on gynecoclinical examination, the case was diagnosed as fetal maceration. Now moves to treatment. The buffalo initially treated to induce parturition using a combination of drugs. Estradiol benzoate used for hormonal preparation. Injection were baked 2 mg intramuscularly. Prostaglandin used to stimulate uterine contractions. Injection pregma 500 microgram intramuscularly. Valtamate bromide, a spasmolytic and relaxant likely to aid cervical dilation. Injection epidocin 80 mg intramuscularly. Calcium borogluconate used for metabolic support. Injection Myfix 450 ml intravenously. The initial treatment failed to cause further cervical dilation within 72 hours, and a repeated dose after another 72 hours also resulted in no significant cervical dilation. Now discussing surgical intervention. Due to failure of medical treatment and lack of cervical dilation, a cesarean section, also called nephrohysterectomy, was performed through caudal left flank approach under local anesthesia of 2% lignocaine hydrochloride. Surgical findings. The operation successfully removed the macerated bony fragments of the fetus, which included parts of the forelimb, hind limb, axial skeleton, skull, ribs, and hoof. Now moves to post-surgical follow-up. The buffalo showed recovery after post-surgical follow-up with the injection oxytetracycline hydrochloride 10 mg per kg body weight intravenously, injection meloxicam 0.5 mg per kg intramuscularly, and injection chlorpheniramine maleate 10 ml intramuscularly, injection B-complex 10 ml intramuscularly, and dextrose saline 5% intravenously for 5 days. Now move to conclusion of this study case. The conclusion of this study case is that left flank cesarean section is the effective method for removing macerated fetus when induction therapy fails. Strict aseptic technique and proper postoperative medications are crucial for recovery. Fetal maceration should be considered in overdue pregnancies with foul discharge and absence of parturition signs. Thank you for watching. If you have any question regarding this topic, drop the question in the comment section. I will answer.